My name is Jaime Montalvo, and I'm here representing the voice of thousands of patients across the state who would like safe access to medical cannabis. As you can see next to me, the computer is off. As you can see next to me, I am a medical patient. I am prescribed dozens of prescription drugs, and these are the medications or drugs that I am trying to stop using. I was diagnosed with multiple sclerosis after waking up in December 26, 2006, with both hands numb, tingly, feeling neuropathy, much the same as a diabetic patient feels. Just a few months later, in 2007, I was officially diagnosed with multiple sclerosis after it had reached my feet. Just within a few short months, I was prescribed dozens of prescription drugs. During that time, I worked in an emergency room in Louisville, Kentucky. I helped to save lives, and I always wondered how these patients had bagfuls of prescriptions. And just a few months after being prescribed or being diagnosed with multiple sclerosis, I was with a bag like this. As you can imagine, these prescriptions have dozens of side effects. Contraindications, liver problems, kidney problems. They cause a lot of issues in our body, and this is what patients are having to deal with today. So the worst side effect that I had to deal with cannabis, which I used to get off of these drugs, was its prohibition. I faced years in jail. I faced the loss of my child, which is pictured here, Eli Montalvo. I lost him for 6 months, not because I cultivated, not because I was found in possession, but simply because I tested positive for cannabis when CPS was involved. Can you imagine what that causes to your child psychologically for your father using a plant to help him live a better life more comfortably, get off of all these other psychotropic drugs that are causing issues to your body? What does that do to them? Imagine if it was your child, your grandchild, that was taken away from their father, their mother. What would you think? Now, I'm here because I don't want to take these medications. We were talking about prescription drugs, FDA-approved drugs and such. This particular drug was prescribed to me. It's an antidepressant. It was prescribed to me off-label for the treatment of my neuropathy. This same drug right here caused me to have increased heart rate and drop my blood pressure to a point where it was dangerous, and I passed out multiple times. And the last time that it happened, just before they found out which drug it was that was causing the issue, I was in a hospital with my father, who was on a ventilator due to a side effect of the medication he was given after suffering a heart attack. So this is what patients are having to deal with. It's not about having a party. It's not about having fun. It's about quality of life. Quality of life for patients who are suffering from illness such as multiple sclerosis, spinal cord injury, ALS, so many different conditions which all cause pain. That's what we're here for. And we're here to discuss medical cannabis. So I apologize, I'm having these issues with the presentation, but the multiple sclerosis has been one of the diseases that's most been studied with cannabis. They found that FDA-approved NIDA, NIH, DEA studies, clinical trials on smoked cannabis was effective in treating the pain from multiple sclerosis, the muscle spasms from multiple sclerosis, and from spinal cord injuries like my friend here, Eric Crawford, suffers from. So it's a promising treatment according to these studies which have been done that are approved by our federal government. So I wanted to know why, if these studies have been done, is it still illegal? Well, I've done the research and I'm here to bring it to you. I believe you have a printout there. According to FDA data, these same prescriptions right here next to me cause one death every 19 minutes. Every 19 minutes, somebody dies from taking these prescriptions right here. Nobody has ever died from cannabis. And that's according to the FDA, not to me, not to somebody off the street. That's the FDA telling us that nobody has ever died according from medical use or even responsible use of cannabis. And according to the Journal of the American Medical Association, a well-respected journal, 24.8% reduction has been found in overdoses in states with medical cannabis. Now, these states are not states that have solely CBD, not states that have solely concentrates. These are states that have medical cannabis. The state has decided through its legislative process or ballot initiative to allow the sale and the cultivation of the flower. After that, a lot of patients do choose to, as you said, Representative St. Oge, inhale. But throughout the time and throughout the history, they have found that smoking decreases and the patients move on to other forms of using the drug. They choose to use concentrates, they choose to use edibles and such. So why is it illegal? Are there other forms to use it? Right now, with the states that have regulated it, they allow edibles, they allow tinctures, vaporized, they allow oils, which are concentrates, they have raw juicing. There's even suppositories that patients can use. If you only allow it in one form, then we'll be forced to come back to ask for it in other forms. What the laws in other states that are functioning is they allow the production and the sale of the flower. The demand from the patient then allows the dispensaries or the facilities which dispense the product to produce these, and we use it how it helps our condition. So I wanted to know why is cannabis illegal? And this is the first statement made by a gentleman sitting in a desk, much the same as in 1937, this gentleman here, Harry Anslinger, stated that reefer makes darkies think they're as good as white men. Now that's almost comical to think that somebody would make a statement like that sitting in a desk like this in front of a congressional body. That same statement caused the American Medical Association to march on to Washington and try to fight against this, because prior to that statement, physicians prescribed and used cannabis as a form of medication for their patients. It was in their PDR up until 1942, and then it was removed. And after this statement, or concurrently with this time, this is when there was a movie made, Reefer Madness, which is actually considered a comedy today. That is when yellow journalism came from. That was actually found, this law was actually found unconstitutional in 1969, and from there we've moved to where we are today. In 44, the LaGuardia Committee found that cannabis is not a gateway drug. They found that it's not physically addictive. Then they found in 1970, after placing it temporarily in a Schedule I status, the Schaefer Commission found that cannabis is as safe as alcohol, and I apologize. Here, we'll do this. Is as safe as alcohol, and prohibition should not be, it's not well founded. In '88, the DEA judge, Francis Young, stated that cannabis can be used safely with supervised routine medical care. In 1999, the Institute of Medicine stated marijuana has medical use and a relatively low potential for abuse. In 2009, the American Medical Association recommended the DEA review the marijuana Schedule I status. But still to today, nothing has happened. Things are not changing. But we do have 25 states that have taken the step and have chosen to use their state rights to regulate medical cannabis. 25 states right now. That's 54% of the population. And right now we have over 1 million patients that are officially registered as medical cannabis patients. Now, there's actually more than 1 million patients, but some of these states have decided that their registries are not mandatory, so their patients don't register. Right now, the medical cannabis laws vary greatly. There's a lot of different laws throughout the U.S. Out of the 25, 23 allow compassion centers, 16 allow cultivation, 14 allow the patients to cultivate the 16 allow the cultivation by the patient. And only 14 of those 25 tax the cannabis products. So as you can see, there's a lot of variance there. These are all the regulating agencies. It doesn't just have to be the health department, which is actually advised not to have the Department of Health take care of it. What we suggested, or what Senator Clark suggested in Senate Bill 263, is that Kentucky generate a Department of Cannabis Enforcement under the Justice and Public Protection Cabinet. That would create jobs for the state, and it would create a way for patients to actually get it, a way to regulate it, and it would create peace officer jobs to make sure that businesses are abiding by these guidelines. So, as I stated, Senate Bill 263 would create the Cannabis Enforcement Department. The department would grade all the applicants and would only give the licenses to the businesses that best applied the law. There would only be 15 dispensaries across the state in area development districts. The grading would be done on packaging, labeling, and safety. This is what the patients are asking for. They want to know what they're ingesting. They don't want to go to the corner. They don't want to buy marijuana off the street. That's the difference between medical marijuana and regular marijuana. You know what you're getting. You know what strain you're getting. You know what quality you're purchasing. You know what you're ingesting as a patient. And that's what patients here in Kentucky would like to have. So with all of these licenses in all of these 15 area development districts, there would be an application fee. Yes, sir.
You have 1 minute.
All right. Well, I will move along. We suggest that we add other departments like the agriculture department. The health department, a few years ago, stated that it would cost the state about $2 million, but would all be refunded by the licenses and such. What patients are requesting, what Senate Bill 263 is requesting, is that all participants register. You have to be registered to enter these facilities. So this isn't for everyone. This is for people that qualify under the law. And as Representative Stumbo put into his bill, you have to qualify under these conditions under DSM guidelines. No advertisements so that we don't glamorize it, no TV, no radio. Prevention and education would be paid for through the fees. No public smoking, no driving and smoking or using it in any way. And if you do, you risk losing that license, so you can't use it anymore. So, in summary, we believe conservatively that this can help over 100,000 Kentucky patients. It would make it, in turn, more difficult for our children to get their hands on because it would be regulated versus prohibited. It would create economic growth, and it would potentially get rid of the black market that we have today.
Thank you, Mr. Montalvo.
Yes, sir.
And thank you for staying within the time guidelines. The chair always appreciates that. We do have several questions.
Yes, sir.
Representative Diane St. Ange.
Thank you, Mr. Chairman. Welcome back, Mr. Montalvo. It's good to see you. I had a question for you on this page that shows the various ways of using this. The goal is to alleviate, reduce somewhat the stress, the the pain, the discomfort of the symptoms of many diseases that you mentioned. If that's the goal, and these are all different ways to achieve that, correct?
Yes, ma'am.
Do each of these ways react different? Why do we need all these ways?
That's a great question. Each way isn't you ingest cannabis, it affects the body differently. For some patients, the oils are too much, so it can cause other issues that they don't want. Now, when you inhale, it acts on your body very, very quickly. It takes away the pain within seconds, as Senator Julie Denton just a few years stated before the Health and Welfare Committee. When you use the salves, you can put it onto psoriasis, so that's another way to treat another condition. When you use a tincture, it goes into your body extremely quickly, within 1 to 2 minutes, and it's a drop under the tongue, which patients today are using for autism, for epilepsy. It goes beyond the CBD oil that Dr. Barnes was talking about previously. I have another presentation which shows a Northern Kentucky epilepsy patient who has tried the Epidiolex that Dr. Barnes was speaking about. She's maxed out. She travels on a monthly basis to Chicago, and it's not helping her. She needs other varieties of cannabis in order to help her with her condition. So who's to say that the tincture may not help her? Or now what they have is patches that patients can put on their body, and it gets absorbed just like they have with FDA-approved medications.
So who would determine, just a quick follow-up, who would determine for each patient that came in which particular method of not ingestion, but which particular process here would be best for that patient?
Well, that's another great question. The way that it happens in other states across the country is the doctor gives you a recommendation to use cannabis. They don't give you a dosage. They don't give you a quantity to use. They simply state that cannabis can be used by this particular patient and it may help them. Then it's up to the patient to go to these facilities that are registered through the state to dispense it and figure out what is best for them. Because just like these medications, some work better than others. So it's up to the patient to figure out which one is better and which one is not. But what we know today is that none of these forms of using the cannabis is toxic. None of them are lethal. You cannot die from it, according to the FDA information.
Representative Montel asked the last question of this distinguished gentleman.
Thank you, Mr. Chairman, and a very, I think, simple question. You referenced 15 dispensaries being distributed across the state.
Yes, sir.
Is there a reason that we can't simply use pharmacies that are already in place versus creating these dispensaries?
That's a great question, and thank you so much for asking. According to the federal government, pharmacies are federally licensed. They have to follow federal guidelines, just like the physicians do. So technically, they are not allowed to dispense a Schedule I drug. They cannot handle the cannabis. They cannot dispense it. They can't be a part of it. Now, one state in particular that comes to mind is Connecticut, that has decided to allow pharmacists to be a part of it. Now, what they did in their law is that force the boards of dispensaries to have a pharmacist on their board, but they don't. Ohio had pharmacists dispensing cannabis, and after going through their debates, they actually found out that pharmacists cannot dispense it, just like the physicians talked about that they can't dispense it. Talking about one of the questions earlier with the dispensing and the CBD oil that we passed, that is the reason that law has not functioned. Physicians can't give you a prescription for it, and the hospitals cannot dispense it either. So what their patients are using today is, as we stated, the hemp law. There's no quality checks for that. People simply go to these facilities that are selling hemp oil or CBD oil and purchase it from there, and they ingest it whether they want to or not. Now, one thing that I would like to touch on with that is, though, there's no quality check. So patients today are getting into criminal issues or custody issues with CPS, and custody issues with facilities where their handicapped children are in mental institutions, and they're being tested for drugs. They test positive for THC, and therefore they're possibly losing or potentially losing custody of their children.
Thank you.
Yes, sir.
That's going to have to be the last word from this presenter. But Jaime, I want to thank you for your patience. You've been in and out of my office the last 2-3 years a lot, and I know it's been frustrating for you. And so I hope this hearing today was helpful to you and present. And I look forward to working with you in the future. And I enjoyed your presentation.
Again, I'd like to thank you for having this discussion, and I would encourage any members, if they do have questions, please send them our way. I would gladly provide any sort of supporting information that's needed. Thank you for your time.
You're welcome.